Hello, my name is Bienvenu, and today we're going to talk about blood culture collections, the process of doing that. So first off, this procedure is usually a sterile collection of blood samples for if we're talking about an anaerobic or aerobic culture, also a fungal or a acid-fast bacillus culture. It can all be collected in the same arm. This procedure is usually performed in the AM. Um, so we want to make sure and thoroughly gather all of our supplies before entering the room. You will also want to make sure that you check um, your record for that to make sure that this lab is still current and that the physician does indeed want these labs before we go in and draw the blood and the lab has been discontinued. Just double check that before you enter the room and double check your labs and which labs, all the labs you need at once so you stick one time. Um, this is just that was just a quick little overview on just making sure you gather all your supplies first. For the blood culture, you want to position the patient, you tie your tourniquet, select the vein, and then release your tourniquet. You need to, in your preparation before, you select the gauge of the needle based on the site and the volume needed. You set up all of your equipment next to you or the bedside. Again, this is going to be a sterile technique. Um, it's it's going to be 3 syringes. Um, it depends on how many, exactly what blood culture you're going to get. Like we said earlier, I just said 3. Um, so open the sterile kit package on a flat surface above the waist. And when you open it, of course, you're going to open it away from you and never turn your back against the sterile field. Opening the syringes, the needles, all of your packaging supplies needed to perform the task. Uh, Now, if you need to retie the vein, the tourniquet again to see the vein, you can do that at this time. Also, you need to clean the site with an alcohol pad, moving in a circular motion and gradually working your way out. You allow this chemical, or excuse me, alcohol or chlorhexidine. It depends on if the patient's allergic to it or which one. Usually, alcohol in a circular motion. Uh, you use alcohol and allow it to dry fully. Then you take your ChlorPrep applicator, you squeeze it, you pinch it, and it's like a little deal. You break it, which then the chemical is going to come to the sponge. At that time, you do not want to touch the sponge because it's contaminated if you touch it. You wet the sponge over and over, make sure that it's thoroughly the chemicals on it, and then you take the sponge and you scrub vigorously on the area that you're going to insert the needle into. After when you go vigorously, you want to go to side motion for at least 30 seconds. And when I say vigorously, I mean don't tear the guy's arm off, but you definitely want to make sure that there's no bacteria or anything that's going to could potentially cause an infection. You make sure that the site is completely dry after. Um, if the site is still wet, then you just start say if it's still wet after 30 seconds, then something obviously is either dirty or there's something didn't. It should have dried within 30 seconds. If it didn't, start this process over again. But most odds are it's going to be completed. Um, Now, at this point, the arm is sterile. Do not touch the venipuncture site after it's been cleaned. If you do, it's contaminated. You have to start all over again. All right, now, at this point, you need to remove the caps on the anaerobic and aerobic bottles. You want to clean the top of each separate. Take your alcohol, you clean one, contaminate it, throw it away. Get another alcohol, clean the other top, so it's 2. You don't want to clean one and then go to the next guy and try to clean it because the alcohol's already bad now. So you want to allow the tops to dry for a minute before you enter the blood into them. Also, the proper way, I take back what I said instead of throwing it away, you allow the alcohol pad to sit on top of it. Now, it sort of ensures that the bottle is still clean. You don't want to touch anywheres on the bottle, or the top of the. You don't want to touch where the needle is going to go. You don't want to contaminate it. I know that's pretty basic, but I just wanted to thoroughly cover all of the just the aspects of everything, because the simple things we often forget, which often cause a lot of problems if we overlook them. Um, Retie the tourniquet, and do not allow the tourniquet to touch the clean site. So again, the tourniquet's dirty or clean and it's a sterile area. We don't want to, if we don't adhere, we don't want to take the tourniquet and put it back on top, then it's dirty again. So just make sure you have ample amount of room to come up. At this point, you went from clean gloves to now we didn't do sterile gloves. If um, so you put all your assembly things together. You have like the little butterfly deal. You got your syringe. Um, Now, on the you can put it back on the sterile field because it's still sterile. Your hands are sterile. You picked up everything. Now you can assemble the second sterile syringe, all the transfer devices. Make sure you just get all of your things together. So you're not in the middle of it and you have blood here. You're trying to assemble. No, it needs to be assembled before all of this, before that step. Just to makes it a smoother transition and lowers the risk of potentially contaminating or clotting. If you're sitting there making more time, it can clot the blood. So now at this point here, everything only touch what is sterile. Because your hands are sterile, the sterile field. Don't go and touch outside because then you have to start the whole process over again. Now, for adults, it's going to take about 10 milliliters roughly per bottle if you're doing an anaerobic and aerobic culture. If you're unable to get less than 5 milliliters on an adult, then it's usually the best thing is to call down to the lab with a microbiology or whatnot to let them know that the patient doesn't have 10 milliliters of blood, and then you can go from there. But if you do have the 10 milliliters of blood, we're going to continue. So for the first, you connect. Obviously, okay, so you put your catheter in, or your needle in, thread your catheter, all that. Everything is assembled, so now I'm going to talk from that point on. It's actually physically pulling the blood out. Excuse me, there's a little gnat in here. Physically pulling the blood out of the patient. You're going to take your first syringe, butterfly needle, and allow the blood flow to come, allow it to come in. Like I said, it started it. Then after I fill that first syringe up, I'm going to take another syringe and connect it and draw another one. The full syringe of blood should be placed on the sterile field, making sure that that syringe I had was sterile, so we can go back to sterile. Make sure that it didn't touch the patient. Make sure it didn't touch anything else. It needs to be a very quick movement because the longer that blood sits there, the greater risk it is for clotting. Okay, so that's important. So after filling all the syringes up and tubes, activate your needle safety and then apply pressure to the area, or the patient could hold pressure while you start doing your transferring to the bottles. So attached, there's like a little device deal you put on the bottle. Usually for the excuse me, it's the syringe. The second, I'm sorry, it's kind of confusing. I want to make sure that I'm very clear with that. The second syringe is going to go into the second syringe. Excuse me, the first syringe is going to go in the aerobic bottle, and the second syringe is going to go in the anaerobic bottle. I get that kind of confused sometimes, and that's just something I wanted to point out because if it's confusion for me, it's confusion for others probably, maybe not, but Just make sure that, because it's all about the clotting and which is the freshest blood for which bottle. That's the theory behind that. Um, Also, if if it's difficult to draw one of the syringes, leave the device on the syringe and use it for both. Um, you may want to put a bandage on this puncture site after, um, whether it's just a little, just a, I don't know, a gauze, tape it up, and tell the patient it needs to be there at least for 15 to 30 minutes. 15, Also, you want to label the the patient identification labels on the culture is a big deal. Then send it down to microbiology or wherever lab. Also, initially going before going into the room, make sure that you print your labels initially. But don't, in Epic, I'm going to speak like you can print your labels, but don't click collected because you obviously didn't. Don't try to cut the corners, because then say if you get in there and you can't get the 10 milliliters of blood out, and then what? You've already said, well, I've collected the data or collected the sample and it's sent to the lab, when really you couldn't do that. So it's a documentation error, and you want to try to avoid that. So definitely just print the labels, continue with all the steps I just told you about in the room. Make sure to do your identifications with your wristbands. Make sure this is the correct patient. Get them to state the first and last name. And then, like I just said, all these steps. And just try to get to the lab as soon as possible. And I think that is everything. Thank you so much. And I'm sorry if it seemed a little all over the place about the different syringes. I just wanted to clarify that to make sure that I was saying it correctly, or that I was on the money with the right one, because it's important, because if you do all these steps and it's the wrong syringe you put in there and it clotted, this whole procedure is a waste of time, and the patient has to get stuck again. So at the end of the day, the patient's going to suffer and possible hospital-acquired infection. So let's fix that and just make sure that you do it efficiently and fast. Thank you so much. I appreciate it, and that's it.